Hi, how are you today?
I'm good, thank you.
I'm good, thanks. I'm Dr. Ndlela, and you are?
Cara.
Oh, hi, Carol. What brings you here today?
I'm bringing my dog Luna to come see you. She's 9 years old,
Okay.
and I've noticed a change in her behavior.
Okay, what kind of change are you
Well,
referring
she's a little bit lethargic, so she's not as energetic as she usually is. And I noticed that when we go out walking, she needs to wee a lot.
Oh, okay. And when did you start noticing this?
Just over the last few months. It's kind of gradual. It crept up on us. It's, I think, quite bad because when she's on the leash, we can't walk more than 5 or 10 steps, and she needs to wee, and she needs to wee again and again and again.
Okay.
When she runs free, it's not a problem.
Oh, I see. Okay, so what I think I can do right now is we can take blood samples and urine samples to see maybe what could be the cause of this. Just to confirm, she's 9 years old. They started
2 or 3 months ago.
3 months ago. Okay. I'll just get a nurse here to come and take samples.
Thank you very much.
Hello, my name is Michael, and I'm from a company. We're doing surveys, communication with doctors and clients, and I would like to know your name.
Karen.
Nice to meet you, Karen.
Nice to meet you too.
The first question I have about consultation with Dr. Ndlela is, did you have enough time to explain the problem to you?
Yes.
Did the vet make you feel uncomfortable or in any
Not
way?
at all.
And did you feel confident that you will solve the issue after
Yes.
the consultation?
I felt he heard what I was saying.
Did the vet express his opinions on the problem in a way you could understand?
He didn't express an opinion as such, but he gave an idea of what kind of investigation needed to be done.
What did you like about the consultation?
That it was direct, clear, and prompt.
If there are any drawbacks during the consultation, what do you think can be improved on this?
I think it will be confidence over time.
Thank you, that's all I needed from you.
Pleasure.
Yeah, hi, I'm Michael. I'm from a company which collects data surveys from clients and doctor consultations.
Hi, Mike.
What's your name?
I'm Dr. Ndlela.
Dr. Ndlela, I have a few questions for you and I'll be out of your hair. First is, what was the most difficult part of your consultation in terms of how you effectively communicated with your client?
I didn't have any problems with the client. She communicated properly, and I feel I did the same.
Did you understand the problem that the client approached you with?
Yes, she gave enough information. So,
how did you make sure that the client understood what you were trying to say to her?
oh, I kind of like did a checklist at the end where like I told her what I got from her, and she was kind of like confirming that it was the correct information.
What did you learn from this experience?
I learned that like if you give a client enough open-ended questions, they can give you enough information, because I didn't really have to pinpoint everything from her. She just gave it all up.
Do you think there was any drawbacks in the way you communicated with the client?
No, there wasn't any from my side.
Thank you, that's all.
Good day, my name is Megan and I will be the evaluator for the veterinary consult which you just witnessed. The evaluation will take place according to the Calgary-Cambridge Guidelines and Framework, and according to these guidelines, a successful veterinary consult can be broken down into 5 various sessions, namely initiating the session, gathering information, the physical exam, explaining and planning, and finally closing the session. Initiating the session. The initiation of this session was done fairly promptly. Introductions were made, greetings were made, the role of the vet was introduced. He introduced himself, he asked the name of the client, and initially basically set the role of who he was and how the procedure would follow. However, it did appear that the vet was perhaps slightly nervous, perhaps in a rush. This can be seen when he misheard the name of the client and pronounced it back to her incorrectly. This may have offended the client, but more than that, it may have indicated a lack of attention to detail, which he could maybe perhaps feel like would be how he would handle his clients. So if anything, it could have maybe set the interview off on a bad foot and maybe instilled a little bit of lack of confidence. However, despite this, he did maintain a good, relaxed body language, was compassionate and understanding and listening throughout the entire initial introductions. However, he did lack some conviction in his ability. He did listen well to the client's opening statement. He didn't jump to any conclusions, and he asked some open-ended questions. Gathering the information. If we have a look at how the vet gathered the information required, he did a fairly good job. He asked very open-ended questions, which is what should be done essentially initially, and then after obtaining a fair amount of information from the client, he did sort of delve deeper into details. Initially, his signalment, he obtained the age, the breed of the dog, and the primary complaint. I do feel that he could have delved a little bit deeper into this, perhaps gotten if she was sterilized, her vaccination, a little bit more of her background, her environment, her diet. There were many more details that could have been filled in there. However, he did get a fairly good representation of the issue at hand. He was lucky in that the client clearly had brought a fair few amount of animals to a vet before, and she provided quite a lot of information without having to be prompted, as if she felt she knew what information was important to the vet. The vet listened very well to the client. He prompted her with head nods, but not in a leading way, but as an encouraging way to get more information out of her. At no point did he indicate that he thought he knew what was wrong with the dog. He never got tunnel vision and focused on a single detail. He did try to get a complete picture. He did establish a timeline in terms of when the problem started and then the progression of the problem. And he also didn't use any jargon or words that the client may not have understood. And in that way, he perhaps redeemed himself for initially the poor introduction that he made by mispronouncing her name. The physical exam. Because of the nature of this pseudo consult, we did not carry out an actual physical exam. As you can see in the video, the animal is a stuffed teddy bear. So if you were to do this, of course, vital signs would have been taken, TPR, etc. Perhaps blood smears if necessary. However, because of the nature of the exam, we did not proceed with this, which I found was fairly adequate. However, it would, in normal scenarios, it would have occurred. Explaining and planning. The vet clearly had some sort of idea of where to go with this patient. Clearly it was some sort of urinary issue, so the next steps would be to take samples, urinary samples, perhaps blood smear, to see if there was any infection or inflammation going on in the client. So he suggested this. However, he didn't really ask the owner for her input or sort of where her limitations were. And even though urine samples are not necessarily expensive procedures, it would have been better if he had perhaps asked her and maybe given her a little bit of more of an explanation as to why he was wanting these samples. In addition, no treatment options were really discussed. At this point of the interview, it may not have been necessary to suggest any treatment as they weren't 100% sure if it was a urinary tract infection, perhaps bladder stones, incontinence from old age, etc. So no treatment was discussed. However, the two seemed to agree on further testing to try and determine what was wrong with the animal. He then at the end did manage to do a good summary of what went on and make sure that he had had all of the facts from the client straight and that no pieces of information were left out, which is a very good way to check that he had gathered all of the correct information and that the client didn't want to add anything else to the story so that they could get a complete and accurate detail of what was necessary.
Okay, so I will be convening the conclusion of our simulated vet consult. As a group, we will now discuss our experiences and what we will take with us in our futures as vets. Okay. So what I've personally learned is that when you open with in a friendly manner, opening towards the clients, it automatically opens them up to give you a better history and makes them more comfortable into giving you more details. Okay. So, what was the experience like for you?
The experience for me was different from how generally practice in our daily veterinary lives. It showed me a different side, just a different aspect of the veterinary science course, and allowed me to um, further deepen my understanding of effective communication, um, people rather than animals.
Yeah, I think just to add to that, I don't think any of us realized how much communication influenced the outcome of a consult, and how, like Denise was saying, that when you ask these open-ended questions and provide an environment that's comforting for the client to give you all of the information, you get a better response, and all in all, it's a better experience for both parties.
Okay, so what will you do different now, and how did this impact your life as a vet, as a future vet?
I think personally for me, it just made me realize that getting to know the client and asking questions in a way that makes them feel comfortable will definitely change the way that I would run a practice. I really underestimated the value of it. So I think definitely for me, I would go forward and incorporate that not only with myself but with all of my staff, with how we even with the secretary, with all of the nurses. Yeah.
In my opinion, looking at how the vet conducted their consultation, I think they could have gotten more history, because then when someone comes in with a problem, you need to kind of like come down to their level. As we are like professional vets, we know what we're doing. They might not know what we are doing to their like animals. So then we need to come down to their level and explain. Just like the vet said, they would take a urine analysis, but then they did not really explain why they were taking that and what would it mean, like the results that they would get from there. Why were they even like taking the first step as like the urine analysis? Also, the vet did like not really take into consideration like the history of the food that they were taking. It's just that they knew maybe that's the normal procedure in the practice. You take a urine analysis if something's related to the kidney and a lot of things, but they didn't really take enough of like the history, what the dog was eating or everything like that.
So, in conclusion, doing this assignment and simulating a true consult really helped us all in seeing what it would be in real life, the type of questions we can ask, and the manner in which the client will approach us also. So, it was definitely a worthwhile assignment.
This experience is that you got to be open and friendly, but also straightforward with the client. And I thoroughly enjoyed the experience. The assignment was really good. And what I would take into my practice is that one thing is that food for thought is that maybe when the client comes in, I would maybe greet them in their home language. Maybe that'll give more add more respect to the conversation, and then go into the conversation with English.